call the meeting to order. It's 8:45 or so. Thank you for dialing in or whatever. As you look at the agenda, you can see what's consuming almost all of our energies, and it's the coronavirus, COVID-19. And it's, it permeates almost everything that we do. In fact, aside from Jim's, but even at Jim's little challenge grant, it's got a COVID-19 component. Jim, are you on yet?
I'm on the phone.
Okay, that's fine. All right, so let's, first item on the agenda are the minutes. Any comments, questions, corrections? I would like to make an adjustment just to that first paragraph. Michael Alaka, bottom line, he was somewhat unhappy, but there were other factors going on. He's got a place in Florida, et cetera, which he'd mentioned to me before. So I would like to put that, just allude to that. And also that, that Michael as well as Judy were offered or asked to reconsider the position or the resignation, which they both did. And, over a number of days, they then decided to stay with the resignation, but I would like that to reflect that. So if I could just make those minor adjustments and then approve the minutes beforehand with those in it. Any other issues or questions, comments? Okay, reports. Jen, is Jen on?
Yes, I just got on. I didn't know we had the meeting. I didn't get the information. Sorry.
That's okay. I hope you did get the notice though, right? As well as the agenda and minutes?
No.
Okay. That's our fault then. We'll make sure that doesn't happen again. Because Kevin did appoint you to be here. And we like having you here, and we commend everything you've done. Jen has been working almost literally 24/7 for the past 3 weeks. So kudos to you, Jen, and the job you're doing. All right,
Thank you.
Let's just, Jen,
Thank
if you
you,
want to
Jen.
discuss where we are.
Harrison, let me second that motion because Jen is unbelievable, and I want to thank her for everything she does every day, all day.
Well, thank you. So the numbers, we're at 62 right now. That's from overnight. We're at 6 deaths. Still have 1 in ICU at Stanford Hospital. We have 4 from Waveney, right, Russ, at Norwalk.
Jen?
Yeah.
I just want to remind you, this is a public meeting, and Jack Kovac, our candidate advertiser reporter, is on here. So we have to be careful we don't talk about anything that's non-public information.
Okay. And then basically that's where we're at numbers-wise. I have contacted every single one of them. Some families I still talk to every single day. And everybody's been interviewed, and all the tracing has been done. And then we're working with the restaurants on making it smoother for them, because some still were not understanding that you can't allow customers in. So Chris, my sanitarian, still been working with them on that part of it. On Saturday, I spent the morning digging out PPE from Saks basement with Dr. Lutzi. So we delivered to both Waveney and Silver Hill N95 masks, surgical masks, and coveralls. So making sure that they have the supplies that they need as well. And just to let you all know, the symptoms that the CDC still has on the website are not what I'm finding when I'm doing the interviews with the people. We're not really getting the high-grade fever anymore. It's more of a low-grade fever. And the main symptoms we're hearing is the loss of taste and loss of smell and severe lethargic. So just so you're aware, if anyone you know starts saying things like that, please refer them to their physician.
Jen, it's Tom. Tom here. Can I ask just one question? you've been in touch with most or all of the people in New Canaan who've come down with COVID. Is that correct?
Yeah, everybody that tests positive, I have
What-
contacted.
What's your impression on how they got it? How they caught it?
Well, a majority of them was from travel. There was some kind of travel link, either domestic or international. And some of the younger generation, like the 20s, they, had either they were study abroad students or they had spring breaks, or the other ones, they had links to Manhattan. They worked in the city or something like that.
Okay.
So
Well, I'm
there's
trying to-
usually a pretty clear link to where they majority got it from.
My question was whether people are whether we are spreading it among ourselves here locally. And
Oh, no. From everybody that I've spoken to, they all immediately, when they've gotten the symptoms, have isolated themselves. New Canaan is fortunate in that they are able to do that in their houses here with separate bathrooms, separate parts of the house. Even like with the all pair that I have, she's up in an attic with her own bathroom. They're able to do that. It's the congested housing in Norwalk and Stamford is why their numbers are skyrocketing. So our community has listened, so that is great. And there isn't a link between this case to a case around the corner either. So that's good news too.
Tom, we also ruled out the men's club as being a factor back on February 28th.
good. Thank you, Jim.
Is there any other questions or can I jump?
You're
Jen,
you're allowed, thank you, and you're allowed to jump and go back to keep
Jen, can I just
doing
ask
the
one
great
question?
job you're doing.
Hey, Russ has a question.
Yeah.
Yeah, Jen, can
Hi,
I?
Ross.
Hi, Jen. Jen and I talk at least 4 or 5 times a day. So again, I just want to echo everything everyone has said in terms of how great you've been during this
Sure, want to come to this?
pandemic. What I wanted to just talk to you a little bit about, and you and I shared some data recently. People can look this up. It's the website is IHME, which forecast peaks and needs for beds, ICU, ventilators, things of that nature for every state. So in the state of Connecticut, they're forecasting us to peak with the number of coronaviruses on April 15th is our peak. So as you can tell, we are several weeks away from that peak. The state of Connecticut currently has 99 ICU beds and 638 that are going to be needed by the April 15th date. So there are some pretty alarming data and statistics by state in there, but I would just welcome anyone that wants to go to that website and look at that data for forecast. And I know it helps us as a healthcare provider forecast of where peaks and valleys may be occurring.
Yeah, so that 99 ICU, so this is changed. That was prior to this. That was what was in the state prior. What all the hospitals have done, I imagine, they've created their own ICUs, like Norwalk Hospital now, from their original ICU, which was 16 beds, half were COVID, half were other medical issues. They've now gotten up to approximately 50 ICU beds, converting their gastroenterology outpatient area to one ICU, using their pulmonary care area to another ICU. So now they have 50 ICU beds, plus or minus. They're about 90% of their ICU patients to date are on ventilators. Not that there are 50 patients in the ICUs yet, but this info is 2 days old, and things happen quickly with this.
What was
So
that,
there are,
50%?
the real number on ICUs are multiples of what the original 99 was.
Yeah.
That site, Pretzel? What's the site again?
It's I will send it out to everybody. It's IHME is the organization that's putting the data together.
That's great. Thank you. Any other questions about COVID? Jen's talking about the loss of smell, the loss of taste. Yes, it just tells you how noxious this virus is. And that's congestion related. You used to have some of those same things with sinus infections. Atypical presentations are like gastroenteritis with diarrhea, et cetera, before other things start. And some patients just present with kind of severe lethargy, headache, plus or minus fever, and then they may or may not go on to develop the respiratory symptoms, but the classic is congestion, sore throat, dry hacking cough, shortness of breath, fever.
Oh, and one other clarification I forgot. The CDC changed the exposure period from the onset of symptoms to 48 hours before the onset of symptoms. So Russ, that would be huge for you going forward.
Yeah, I mean, that is classic for all these respiratory viral things, the flu, et cetera. You're contagious for a 48-hour period before you develop symptoms.
Jim, I have a question for Jen, or all of us. What's the latest on the testing? Normally, Handler gives an update on when it's going to be, but I didn't hear any more follow-up other than in the hospitals. Are we doing anything more in New Canaan?
We haven't had the demand here calling. Mike and I got off the phone actually talking about this. So we haven't really had the demand. I've only had, a handful of people call. So what we've done is tell them to talk to their medical providers to go to Norwalk Hospital because it's a faster turnaround time of 24 to 36 hours. But Mike and I are working on something else. If we can manage to get the rapid testing that's supposedly going to be available in the next week or so, that would be ideal to do more of the rapid. Then with Dr. Murphy, the problem becomes Quest Lab is just taking too long. Waiting a week to get the results is not productive for us, for tracing purposes or anyone.
Yeah, Dr. Murphy was sending his test to LabCorp, and that was at least a 4-day period and sometimes 7. And there hasn't been the demand in New Canaan. Norwalk Hospital is doing about 150 to 200 tests per day, Monday through Saturday, starting at 9, ending at 5:30. They've extended their hours. Their turnaround time is 24 to 48 hours. They do use a lab, Sonic, which is up in Milford. It's like Quest. It's one of these big international labs. Both Stanford and Norwalk Hospital are in the process of getting faster testing, which they'll be able to do on site in the hospitals themselves. One is Cepheid, which is a 45-minute test, and the other is BioFire, which is about a 2 to 4 hour test. They both are going to have them within the week to 2. Abbott has come out, another lab has come out with a very quick test, which I think can also be done at least on site, maybe in offices. Jen, do you know?
I don't know. We spoke to BioFire last Thursday. I spoke to them, and they said that it'll be out mid-April, so probably another 2 weeks. But they said the federal defense contract gets it first, obviously.
Yeah.
So we're not going to hold our breath on BioFire.
The testing in terms of the availability, all these hospitals can do it same day as of now, and to get results in 24 to 48 hours is great. So there's a significant improvement along those lines.
In Norwalk Hospital, even if you go in for something else, they are testing. So that's how I've gotten some of these. They're not symptomatic, or they have very minor symptoms that you won't even notice, but they went in for another reason, and Norwalk Hospital tests them. So that's a good thing too. Because
it can have, even though we know what the classic presentation is, as I mentioned, it can be very atypical and be COVID. Just lots of muscle aches and pains, classic flu-like thing, even without the congestion. And so that's why they're doing that. And there's a lot of overlap going on. People are testing positive for COVID as well as the flu, which is not surprising because that's the history of medicine, essentially. You can have two things ongoing. And you can have an active case of flu and be a carrier for COVID, and you're going to test positive for both.
Harrison?
Yes.
Harrison or Jen, do we know if any of the local hospitals are trying out these new drugs in some kind of a trial or test?
Don't invite
Y-
David.
Yes. So the last two that we had that passed away, because I speak to the families every day, multiple times usually, they both tried that malaria Z-Pack combination for the 5-day trials, and both, it didn't help because they were too far into dialysis and on the vent at that point. One now we're trying, possibly to do the convalescent plasma, but which was FDA approved, but they're still working on that. So they are trying things. They are.
Thank you.
Yeah, I know the hydrochloroquine, they're using it in India. The coronavirus is an RNA type virus. There are two types, one's RNA, one's DNA. And this hydrochloroquine interferes somewhat in the DNA process. So they thought it wasn't going to be effective, but there are some mixed reviews there, and it may be actually decreasing both zithromycin and this supposedly decrease the quantity of viral burden. And not that it's changed the symptomatology or the course of the disease as of yet. New York City, they are doing significant studies with this. So remains to be determined. And there's also an antiviral that they're using to see what that does, a new one. But as of now, there's no definitive improvement with any treatment that's out there. Okay, let's see. Any other questions of Jen? Thank you, Jen.
Thank you. Bye.
One other thing on COVID before I leave, and it's, they're learning as we go along. So initially it was not airborne, and then it was thought to be airborne for 30 minutes. And the latest that I've seen, and I don't know how valid it is, but it can be airborne for 3 hours. So, that is problematic in terms of the contagion. And to be safe from the airborne, the masks aren't quite good enough. Masks are always helpful, better than nothing, in my perspective anyway. But you have to be fully shielded, et cetera, to avoid, and N95 masks to avoid the airborne status. Okay, let's see, Bethany, Senior and Adult Services.
Hi, so Senior and Adult Services, we have, I'm just going to give you numbers. If you have any questions, ask me. We have 200 volunteers signed up as shoppers to help the seniors. And there's been a huge outreach, public health announcements going on at the grocery stores. Aggie, Lynn, Barb Achenbaum at Staying Put, they're getting out to their seniors. Men's Club, it's incredible, the community outreach team that has formed and the dissemination process to get them to stay at home and let someone else grocery shop for them. So I don't know the numbers in the organizations themselves in the faith communities, how many people are helping the seniors, but from the human services aspect, we have over 200 volunteers that have stepped up to the plate, and we have now over 60, almost 70 seniors that are taking us up on the program. And it was a slow start because of the isolation issue. They enjoy going to the grocery store on a daily basis or every couple of days. It is their form of socializing. So we are stressing the fact that it is imperative that they keep themselves safe as well as others and stay away from the grocery stores. That being said, the flyers have been passed out at Acme and at Walter Stewart's, putting them in the grocery bags so that we're not social profiling anyone. If you're older, we tell you not to come in. There was a little bit of insult going on because some people, they looked over 60 and they were told you should have a shopper. So we're trying to get away from that social profile or age profiling and just putting something in their grocery bag, everybody across. So maybe they have family members and they can tell their family members to stay home or I'll shop for you. That Aggie has done 75 plus has been her focus for the population, and her numbers were there are 1,500. She's on the second round of calling with her There have been volunteers stepping up the plate. They can't go out because they're seniors, but they can call, and they're very good on the phone, as well as members of other organizations, and she's rallied the forces. The second phone call completion should be done today, she said, and then there'll be a third one probably the next week or two. Telling them what programs Human Services has to please call Human Services. They also have LAPM. They're connecting, have a friendly chat, connecting them with a phone buddy. And we're just trying to give them seniors things to do so they do stay inside. And that is going well. Are we going to do food pantry now, Harrison, or you want me to wait on that?
No, I think we'll do that now.
Okay, so the food pantry, when there was information that was disseminated that somebody in Millport has tested positive. As a result, with the grapevine, rumors had it, so my volunteers for Tuesday distribution said they felt uncomfortable working at the food pantry because they know clients are from there. So as a result, Harris and I spoke, and we're looking ahead as well with this peak coming in the next couple of weeks, and we don't know how long it's going to plateau at that peak. We have packers that are going to continue with this next food distribution on next Tuesday. We are going to do a huge packing. We're going to double up their food items. And along with that, we are going to give them a gift card to get them through the next two food pantries, which would be April 21st and May 5th. And that way, it'll give them the money to go to the store. They are Acme food cards, which we feel is appropriate because we have given so much business to Walter Stewart. We do want to help Acme out too, and to be fair. So we have purchased about $4,000 worth of gift cards from Acme, and we are giving, we figured out that the payment, it's going to be $100 per individual if you live alone, and then each person in the household after the first person, there'll be another $50 placed on the gift card. So one person will get a $100 gift card. If you're a two-person household, you'll get $150, and then consecutively. That will cover them. We will give that will be their 2 weeks of having the food pantry closed. And then we will reassess and see where we're at. And if we have to do food pantry again, we have generous donations in terms of financially. We have about $20,000 in our food pantry fund. So this is going to bring us down to $12,000. It's going to be about $4,000 per distribution for the 2 consecutive weeks not serving food. But we feel this is the way to do it. We cannot have volunteers in close proximity packing these bags and then going out and putting them outside on the curb through the drive-through so that residents pick it up their own and bring it out. We just feel like we're asking too much. We can't expose people like that. So this is how we're working with the issue. And anyone has any suggestions?
No, I mean, there'll be 4 volunteers on Monday to help with the packing. They'll all be totally protected with goggles, face masks, gloves.
Yeah.
And I think it's a great solution for them, actually, to carry this through. So the next food pantry as date would be like May 19th. So this will carry them through the early part of May anyway.
Yeah, it'll get us through.
And beyond.
I had a meeting with all the local small town directors, a Zoom meeting this week, and they've all closed their food pantries and they are only giving out food cards. So it's definitely a universal feeling amongst Fairfield County about the food pantry. It's too much exposure at this point.
Bethany?
Yeah.
I think we should probably get some news out to the media too about seeing if we can take more donations, because we've gotten quite a few calls about it. So maybe we can put something together to give some specifics.
Financial benefits.
Financial, yeah.
Yeah, and
And
the
if the
community
people are
foundation
calling
fund, I
in-
think, has $200,000 and they've been making grants. I think
Right.
we ought to talk to the community foundation about some of those funds.
Yeah, and there are also going to be people calling, they can't pay their rent. What are we going to do? And we are Human Services. That's a whole nother issue. I mean, I am pointing them in the direction of the Department of Labor with their employers, employees, and what they're setting up for their programs, as well as the IRS with the $1,200 and up. I'm pointing them in that direction, but as we have to figure out too, in terms of the money that we're going to have and how we help these people that are not clients, so to speak. We don't have time, nor do we want the exposure of doing these complete financial assessments with documentation and things like that. I mean, these are people in trouble. We need some just-in-time helping. So that's starting to evolve too, as the situation gets a
Actually,
little.
that's where we also should coordinate with the community foundation, because they have a fund, Help Your Neighbor Fund or something, that people who don't qualify on normal standards
Yeah.
could
This
be
is just,
aided by the community foundation.
yeah, it's just situational hardship right now. So
Right.
I'll work with them on that.
Bethany, I'd also like to note, Bob Mantilia, who's on here, it's ironic, we did this survey of seniors
No, he's here.
back in January, because the
I see
database
him.
we have, we know where all the seniors are. And we've been working with Aggie and Bethany to make sure that every senior is over 75 is covered by this outreach. So Aggie and Lynn have done a remarkable job as well in staying put. So we know exactly who's being covered by whom. But we still need to ramp up that number of shoppers for seniors, because there's probably 200 or 300 seniors that we should be shopping for.
I agree. I was disappointed in the numbers, but we doubled our seniors this week and gone beyond doubling, and I'm happy about that. But that was something I did not expect. So, yeah, it's definitely.
I noticed Penny's on here. Penny, you were adopted by Tom Herbig.
Okay.
Bethany,
Yes.
are we,
You shouldn't be going to the supermarket, Penny.
No, we'll be sitting listening to the Stanford Symphony is what we're going to be doing. Oh, I love it.
is
Now,
the
now we have
advertiser,
to get Kevin adopted.
I thought Nick adopted Kevin.
He's not eligible.
I'm not eligible.
Kevin, I thought Nick adopted you. Didn't Nick say he adopted you the other night?
Yeah.
When I was over at Walter Stewart's yesterday, Alex had told me that the seniors seem to be catching on. So I think we'll see a slow, steady ramp up of them getting the message.
Thank you, Bob, for all your help.
Is this something that the advertiser can help with, since so many seniors do read the physical paper?
Yeah, Jack.
Yeah, let me know what you need out when, and I'll get it out ASAP.
Thank you.
And anything you guys need, just shoot me an email. Kevin has my cell. If it's something off hours, I'm reachable
Yeah.
24/7.
I mean, the real issue is people think that I'm not frail, I can shop for myself, and that's not the issue. The issue is the susceptibility to contracting the disease.
Right. Barbachenbaum wrote a piece that's in today's print issue that
Right.
tries to address that. And maybe if you can get us in touch with some seniors who have chosen to go the shopper route, and I can talk to them about how helpful it is to them and how much safer they feel at home with somebody shopping for them, maybe we can get more people to take down that barrier that they have up where they're resistant, because I'm certain it's like when you get offered the senior discount for the first time. Not everybody's as cheap as me, and some people get upset.
Jack, I will. I'll work with you on that, and I'll see
Okay,
if there's a senior that would volunteer their
that would be great.
situation. Okay.
That would be great. Thank you.
Hey, Lance,
Stephanie?
who's your volunteer?
My volunteer, my daughter.
Okay, good. We have the capability to every senior over 75, which we have 2,900 of. Bob?
We have,
Oh, that's over 65.
yeah,
1,500?
1,500, about 1,550. The list we made yesterday for the postcard mailing, we took out all of the couples
Right.
that are in there. So we got that down to about 1,100 households.
Good.
Hey, Bethany,
Yes.
it's Jim. If we looked at, in terms of the 60 or 70 seniors that are currently in the program of shoppers, how many of those do you think are of the several hundred that we are the high-risk citizens that the department manages? All of those people that are the high-risk people ought to be on that
Oh, do you mean the vulnerable population list?
vulnerable population. Good.
Yes. I have to look and see. A lot of those have aides that are shopping for them, and they prefer their aide to shop for them. Or there's an adult child in the family. We do have a few that we are shopping and getting prescriptions for. But all in all, these people have been vulnerable and at risk already, and so they do have something like this already set in place.
Okay, thank you.
Yeah, keep in mind, Jim, we've matched up all the groups that, Staying Put is really taking care of their membership. The Meals on Wheels folks are spoken for. The Waving Care Center has 150 or so people. And the churches are and clubs. The Exchange Club is working with their senior members. The Men's Club, we need to do some better work with 300 members there so that we can make sure that we know every single senior and who is there, whether it's a church member, it's a family member, it's a Staying Put member who's responsible for that senior.
And even the listers are getting hit, solicited by 2 or 3 different groups in addition to St. Mark's for shopping. I was very impressed because I think of myself as young. But again, the community is doing a wonderful job in outreach.
Another thing, when I talked to someone yesterday who's a St. Mark's parishioner, and he was ordering groceries delivered from both Walter Stewart's and Whole Foods, that's not the safest way to go about, because the pickers are using gloves and doing multiple, as good a job as Walter Stewart's is doing to stay clean. It's much preferable to have one person pick your groceries and then bring them to you than to have delivery with pickers that the store is using.
Yep, I agree. Okay. No, the community is doing a wonderful job, and again, the town and all of the moving pieces are to be congratulated. We've really come together. So terrific. Thank you.
Kevin, to your point that you just made in terms of one person, I think that needs to be in some communications. I know a lot of people right now are just ordering their food and having it delivered and putting it on their credit card and have it delivered to their front porch, seniors. So I think that point, maybe Mike Handler can address that in his daily letter, or Bethany, you can include that piece of information in the.
One of the deterrents from not going grocery shopping by themselves or using the, let me go back on that, using the Walter Stewart's or the Instacart or some Peapod, they are over a week and a half out for groceries. And people don't have that enough on hand to get them through. And so that's sort of forcing them to use our program too. And I think it's great. Whatever works.
And the other thing is we ought to emphasize, don't forget the restaurants. This is not just groceries. A volunteer can go to restaurants to pick up meals for the seniors as well.
How are the restaurants doing, Kevin? Are they close to breaking even or not?
I think some are doing relatively well. And as long as they keep their staff, a lot of them are paying their staff, but not, I shouldn't say a lot. Elm, for example, is going to pay their staff regardless. But our concern is if Metro North ceases running, we're going to lose both people that work at Walter Stewart's and people that, a number of people commute to New Canaan by Metro North. And a lot of the restaurant workers come up by Metro North.
Yeah, I mean, one concern about the takeouts are just the quality of control behind the scenes and how aseptic they are, et cetera. So it's a question mark. They have to be standing there overseeing them to see the process to really know the truth. But it's a concern from my perspective anyway. Bethany, anything else with?
Let's see. No, that's all. I just wanted to thank everybody. Oh my gosh, with this community outreach team, it's absolutely incredible. I'm just amazed. So.
One thing, the school nurses and what they're doing with the seniors too.
Yeah, they're so
They've
active.
been on the phone. So these nurses that take care of kids are on the phone with the senior citizens, and both are enjoying it immensely. So I think it's been a positive.
Very much so. Yeah, we thank them and Janet Reed and her staff of nurses. They've been incredible, and they call me, they contact me. They have all their nursing notes written down, and I'm reading those, and we're really in touch. It's a great system, and they're really enjoying their seniors.
The town overall has been so impressive with this emergency operations center, et cetera, the communication, and everything that they're doing. It couldn't be better. Despite the terrible scenario with the COVID, this town is functioning as well as can be given the background. Let's see, Jackie, Youth and Family Services.
Yeah, hi. Yes, I've been working sort of on the mental health piece of things and reaching out. And some of you have been on some calls where I've said this, so sorry for the repeated information. But with about 50 therapists in New Canaan alone, I would say 30 have all responded, have moved to like a telebehavioral health model. I would imagine they all are offering that and are willing to squeeze people onto their caseloads. Some of them have offered, pro bono for, residents in town with any anxieties. We've actually put one therapist that had reached out to Lapham that I got in touch with. We've already put her in touch with, she's helping a senior and a domestic violence case that had come in the last week and a half that was, pretty severe. Those numbers have obviously gone up, domestic violence. I've probably spoken to, the police maybe every other day just about, cases that are going on because, courts aren't available. People can't go file, not everyone probably knows how it works, but if a cop responds to your home for a domestic, a protective order is put in place, which is a good thing. But if you need to file a restraining order, much harder to do, especially if you don't have access to the court offices for that. So, really utilizing domestic violence crisis centers. They're not open, but they can certainly, advise people how to do that and, file paperwork for those people. So we've been working around those issues. I've probably spoken to the school, I believe, if not every day, every other day, because Bethany and other people on the call had mentioned earlier that there's certainly people that are not on our caseload, but have kids at West School that, maybe they're divorce situations where, the ex isn't paying something and they're scrambling and they're communicating this to the social worker at the school. So I've spoken to a couple of families at West that are tapping, actually, Kevin, just so you know, the Community Foundation Touch a Life Fund. We aren't the only ones that have access, and we do vetting of those families with all of our financials, but the school and the churches can tap those accounts without those questions asked. So I've, talked to a couple of those social work. It has to be a social worker that knows the family that's working with them. They won't just take a request from, any school, teacher or, but so in those situations, we've kind of talked through what might be needed. And also after this is all over, maybe those are people that need to come onto our caseload. As this goes on, definitely hearing some panic from a lot of our clients. A lot of my clients, are cleaning ladies, so they've now not been able to obviously go in, and they have kids, so they've been home now since March 12th, and there's no income coming in, so they're pretty terrified. We definitely did a partial rent assistance yesterday for someone that will help them through April. I said normally I don't get involved with landlords but I said I'm willing to talk to some landlords if people need that, because I don't think that they can, use sort of these punitive actions right now with their, with their tenants, because the whole world is, offering leeway, and, so I definitely have seen that. On the behind the scenes, where we launched our 30 Days of Family, which is a website with the Chamber of Commerce. If you just Google 30 Days of Family New Canaan, it'll come right up. It's really a positive thing, because there's a lot of, just bleak sort of negative, stuff going on with everybody. So what that is housing is all the great things that the community is doing virtually, what you can do recreationally. The Y is hosting, I think it's this weekend, a family dinner at home. So you can do that at home, and that would, it's basically just giving people information, and we have blogs that are being written by several people in the community. It's in the Advertiser already. I think it was going to go to print if anyone gets a copy of that. So at least, that's something positive we can be doing, and we're going to keep, we've gotten a lot of pictures. Thank you, Alicia. She got a lot of pictures from families doing stuff at home, together as a family, and we're posting those pictures. It's just, we're all in this together, and we just need to support one another. I also thank you, Alicia, she had posted my name to the New Canaan Moms Board, because we know that we get a ton of traffic there, just to say if anyone was in need of, therapists or resources, to please call me. So I definitely think those numbers, will continue to rise. I just hope that people don't wait too long, and when it's crisis mode and then they need something immediately. I've spoken to a couple of parents with kids that struggle with like ADHD, and so it's come out that it's the e-learning, but they didn't have any support outside of school. So I've, had to talk some parents through that and get them linked up with the right people that can help them. There's just so many amazing things that are going on. And I can't thank all of you enough, and all the volunteers beyond that. Any questions for me?
Yeah, Jackie, how about some of your clients who have lost their jobs, like the house cleaners, et cetera? Is there funding available for them for food, et cetera? Are they at that stage?
Not beyond what we've been able to offer, and they've all attended, the food pantry. We had a couple of clients that have some, immune compromise, and they're not seniors, where they got a delivery of food the last time. So in terms of that, not all of them get food stamps, but, some of them do. So, and I did hear that number was going to increase, I think it was like 15% above what they've gotten in the past, just to kind of offset some of it. Some of them have asked me about these stimulus checks that are coming. I've seen in the news, maybe you could potentially look to that at the third week of April. Is anyone hearing? I don't know if that's guaranteed. I don't know where that money comes from. We have some people that are, undocumented, that, like a cleaning lady isn't going to be able to get the unemployment, or, if they're working under the table, or hopefully the hope is that they can get back to those jobs, once things are safe, but yeah, I just think it's really going to kind of unfold as the weeks go on, which is scary for everybody.
Jackie, some of the clients that have been hesitant to apply for food stamps, thinking, I won't get very much, it's not worth it. Maybe it should be suggested again that they do try to apply. I think the criteria is more lenient. I know that doesn't help the undocumented, but at the same time, it might increase somebody's food stamps.
I've heard from a couple that the system is like jammed. I'll look into that today and try to call the state to see, massive amounts of people are, trying to access that. And the only way they're going to be able to do that is to, do that online.
Right.
So, or possibly over the phone, because a lot of those workers, are not in the office. I know I spoke to people at Eversource. We have a social service hotline, and, they're all working from home and, doing the best that they can too. And they've been very helpful. But I might want to, look into the process first to see if how easy that's going to be. I know we've had clients that have had challenges. I know, Bethany, you've helped seniors with this too, that don't know how to do it online, or how to submit that paperwork, and right now we can't access helpers, for that in person, meaning
But if anybody needs help doing it online, if they have access to a computer, literally, I mean, it probably takes a half an hour, 45 minutes. You know, I can stay on the phone and guide them through it, and then they're set and they submit, and within 48 hours, they could be getting an emergency check, emergency card with food credit on it. So
Jackie,
Yes.
Russ Parksdale, and
Yep.
Happy to do this offline with you. There are a lot of healthcare providers out there that are still open, and if you have unemployed, even if it's temporary housekeepers and food service workers, there are a lot of us out there that are trying to bring on temporary, because you can imagine the amount of cleaning that is having to be done during this time. So offline, if you can just send me that information, I'm happy to have a channel for those people who are looking for jobs.
Yeah, and you're saying like so Waveney could utilize some of those people to kind of help out.
For all healthcare workers that are still open, so absolutely.
Okay, great. That's great. I will definitely talk to you offline. Thank you, Russ.
It's me, and don't our restaurants need delivery people or prep people? And the grocery stores need help as well. And that will be particularly critical if we, have limited train service.
Jackie?
Yes.
Jim?
Yep.
I want to give you a perspective on, and particularly with the unemployment. Again, through my post at Career Resources, we normally handle 30,000 unemployed low-income people on a going basis. It's already up to 60. The big thing is that if you're going to be talking and having people apply for unemployment, and particularly because the only way you can apply now is online, and those that, like everybody across the country, but we have 120,000 in the last 2 weeks, and I'm not sure what adding this week is going to be. But anyway, the net of this whole thing is the lines go down frequently, and so you got to be very patient. It might take you 3 or 4 days to be able to file and for them to get back to you, and then the services and whatnot that come with that are still getting organized. So it's just be
patient. Yeah.
You have to sell them on being patient, because it's going to take a while. The other thing was Lamont's office sent out a thing yesterday to through the Department of Labor that anybody that had already filed, it might be as late as mid-May before they see anything.
I saw that there's major delays in those checks.
So it's the Department of Labor is totally overwhelmed, and it ain't going to go away anytime soon. And if I need money to buy groceries tomorrow, I need an option. So that's a perspective that's going to be with us for a while.
Jackie,
Okay.
as of a few days ago, the domestic violence cases were not being reported to DCYS or Department of Family Services, whatever. So why is that happening? And when you're seeing this increase, are they going through you? Are they going directly to the police? What's the issue there?
Wait, I'm confused about not being reported to DCF. Where was that number? I don't.
That was actually Dr. Lutzy had mentioned that he'd spoken to them. They were only getting like 5% of the calls they usually get.
You're saying, DCF was getting them?
Yeah, right.
I know that, frankly, New Canaan is, we've, like school staff, people have felt uncomfortable to kind of make those reports for lots of reasons, but the police have to if there's like children involved. So we've had a couple of instances where it's been like a teenage son, punching a father. I mean, that was one case. We had a serious one where there was a strangulation and, threatening, and that father was removed, and there were 2 children in that household, and the school's been working with me and the police on that case. So, yeah, I'm confused as to what the police have to involve DCF if there's a child involved. Obviously, they would. So they've had numbers go up with, just a married couple without children, and you can see a lot of those arrests, in the paper. So I'm confused as to what Dr. Lutzy means.
We're just I guess there was less formal telephone and reporting of these. So, just that's another side issue. Okay,
Yeah.
thank you.
You're
Anything else, Jackie?
Not that I can think. Oh, I know that I'm excited. Thank you, Harrison, for agreeing. But we are going to be working on a podcast with Harrison and Dr. Gerber from Silver Hill. And I do believe we're adding Chelsea McGee from the Center for Hope Family Centers. You know, and really that topic will be, you know, just a tentative topic is around community health and sort of this anticipatory grief, you know, just that everybody's in, you know, losing people, or they're losing, you know, the things that the uncertainty of just, they can't get back to the life that they, you know, once knew, and all of the kids that, you know, there's no prom, there's no graduation, you know, so that's probably going to be coming up. I know they'll be reaching out to Harrison if they haven't already. It's Bob Doran, and the interviewer is Cindy Graziano. So we're happy to have that on the books coming up. So thank you again for participating.
You're welcome.
And I think I'm good if no one has any more questions.
Thank you, Jackie, for
Thank
everything
you.
that you're doing. Old business, Jim, the AARP Community Challenge Grant.
Yes, sir. I'm going to be mercifully brief because hopefully everybody got the draft of some of the main parts of the grant application. I want to therefore just talk 2 or 3 minutes about where we started, which was to look at the normal problems of anxiety, depression, and loneliness that seniors face, and how we can tap into using telehealth type stuff. And actually, Jackie mentioned
Kevin Moynihan, but I'm on another call, so I'm going to mute myself.
Okay, all right. So basically, when we started out, again, we were looking for the basic problems. Now we got all of those basic problems have been blown way out of proportion. And I'm delighted that we have telebehavior and all of the other things that Jackie has mentioned, and Bethany as things that are going on to deal with behavioral health. It ain't going to go away. As everybody knows, it's going to be with us. And then, therefore, this grant originally was due on April 1st. The week before that, they called to delay it to the middle of May, 15th of May. The grants will be selected by probably July, and then the money and any programs would be done in the fourth quarter of the year. That's a long way away, and from a standpoint, our original reason for going after the grant had nothing to do with the virus. But the virus has now blown everything way out of proportion, and so behavioral health is going to be equally important to physical health. So the net of that is that the need is going to be there for some time to come. I thought we would wait and see, with or without this grant, we need to do something for seniors' long-term wellness and look at behavioral wellness, and to look at using the basic reason that we focused it on the 300 telehealth people is we know that all 300 have a computer and link to the internet. So that's, and have evidence some evidence a need to be involved and be educated in their own health care with technology plus a human being. So ostensibly, again, that's the reason for focusing on the 300. But if we do what is proposed in terms of a broad-based education and engagement of behavioral health for everybody, we will hit a lot more people than the 300. But the reason for the 300, there are 3 or 6 categories totally that AARP is soliciting grants for. We are going after 3 of those, and the biggest one, where I think we have the best shot, is called the tangible value of smart cities. But then the healthcare services and increasing civic engagement are also things that will pick up in some form of this. So at this stage of the game, the big thing is to simply, over the next couple of weeks, finish the meeting with all of the partners, which at this point are Silver Hill, Waveney, the Hub, and the 2 departments for the town. Stanford Hospital was in, but said that they're up to their gills right now in other problems, and so they'd like to be considered down the road, but not right now. But we don't need any more partners of the moment. to get started. But where we take this from here will depend on what happens over the next couple of months. And by then, maybe when the grant is given, then we can merchandise it and see where else we go. But fact is, it doesn't cost a lot to, it doesn't cost anything to make the request. And down the road, we'll see what the landscape of the community looks like in terms of need. But definitively, it's going to be needed in some form or other, and this is just one of the many tools in the bag that we might put together.
Compliments to you, Jim, on a very thorough and impressive application. I know you did a lot of work with that, or maybe it was off the top of your head. My only question was going forward is getting the people aligned to partake in this every other week thing, but that's a topic for another day.
Yeah.
Alicia, I just wanted to ask you a couple of questions. One was the e-learning seems to be going okay, right? Oh, you're on mute.
I unmuted myself. Yeah, e-learning's going well. The school ramped up incredibly quickly. They did a 2-hour delayed start the week before e-learning started to get a jump start on planning. And they've done a beautiful job. I mean, I've heard almost universal, praise for the job that the schools have done. They have decided to alter spring break a little, so there's not going to be a full week off. They thought that would be detrimental to the learning process. So the kids are going to have e-learning Tuesday, Wednesday, and Thursday on what would have been spring break. And people are trucking along. My second grader had a Zoom class with his teacher, and they've gone on virtual field trips. And I'm learning all about Mesopotamia all over again. So it's really, the schools have done a wonderful job, and the principals have been great about also, keeping everyone informed, and everyone's been really happy.
Thank you. What happened with the town council vote last night on the schedule, buses, et cetera?
I didn't get the final, I didn't hear the final vote. What was it? Was it Monday or Tuesday that they had, I think it was Monday night, they had a Zoom meeting and 50 parents spoke in favor, but I think the vote was going to go to cut the budget. I think that was where the vote stood as of Monday night. The final vote, I guess, was last.
Can I answer that? I can answer that question, Harrison. The vote is tonight, right? And I think I just saw a message earlier today from New Canaan moms that they didn't think we were listening. And I can assure everyone that all 12 members of the town council were listening. We're listening with extra specially sensitive ears and minds. We have an entire community to serve, and our decisions tonight will be based on serving the entire community, based on what's going on in the world today.
Thank you for the update. Any other questions, issues? I think it was a good meeting. Thank you all for joining. I think our next scheduled meeting is May 7th. It will probably be another video Zoomed meeting.
Harrison?
Yes.
Can I do a grant request?
Oh, yes. Sorry, skipping that. Yeah, go ahead.
It's all right.
Yeah, we did discuss that last meeting. New Canaan Cares wanted to, and this is for an educational program for the Sachs age group. They requested $4,000. We had agreed at that point in time to contribute $2,000 with question mark. We would possibly go further if needed to get this underway, because we did not want to lose this speaker, et cetera. And that's where we are. So this was a formal request for the $2,000. Jackie, are you there?
Or
I'm here, yeah.
How do we stand with that? Was that $2,000 enough?
Oh,
I think Bethany, it was asked to Bethany out of our main grant.
I spoke
But
with
did
Ellen.
she change it? It looked to me like it was changed in this with these requests.
So I spoke with Ellen at New Canaan Cares, asking her, where this was at, the request, and she said that the email said that they have canceled both the programs for spring at this point, but she is asking if the commission would consider an unrestricted grant in the amounts. However, the $2,000 and the $1,500 for a total of $3,500 to help cover the operating costs during this time. Their home tour was canceled, which was scheduled for May 14th, and they usually raise about $68,000 for that. And so this income, if we could put this 35, that's for staff, to pay staff, and so that is not happening. So she said she understands that the request is unusual, but if we could change this request to an unrestricted request for $3,500, and I wanted to give you an update on the account itself. The original appropriation for the account was $23,000. Year to date, we have given out $14,240. The encumbrances of the $4,400 are all on hold, and those have been canceled, those programs. So if we take away the encumbrances and also add what's available, we have a total of $8,760 right now left over until the end of this fiscal year. So that being said, how should I respond? I'll listen while the discussion takes place, but she is asking for $3,500 unrestricted now. She did say that the middle school leadership program did meet twice before school was put on hold, and they have to pay the facilitator for those 2 sessions, which equal $666.
I have a little bias against unrestricted.
Mm-hmm.
So that's where I am. I know they do great things, and maybe they need it to keep functioning as they are. I'd like everyone else's opinion on that.
Yeah, I tend to agree with that.
Should I ask her to resubmit requests with a purpose?
Yeah, we tell them that we like to know where and for what our money's going for.
What Bethany, it's Tom. What will they be doing during this strange period we're in now?
Jackie, can you help with that? I don't know.
I know that, sorry, take you off speaker. I know that, Ellen is offering, a lot of just virtual, Zoom. I mean, she's done great messages out to the community. I know she's on a podcast, Beth New Canaan. I interviewed her about mental health as of yesterday, and that looks like it's live. I'll probably listen to that when we hang up. But, so she's also had to get creative with those youth leaders to get those groups running via Zoom. So, those things can still, take place. So she still, needs funding. And I wonder if the way that I even work with my grant is if it was just maybe that this half the year. I mean, so there's probably been a lot that's been done from January 1 till now. But again, if those leaders continue to work with those students, and, she has several groups that, she's got to get creative with, and, and those kids are still being, she's still reaching out to them. And so, even though it's not like a physical program or they're going to the space, I mean, they're still connecting. So I think, and it's a shame that we can't have that speaker come in May, the one on that did a TED Talk. That's really, really a bummer. But yeah, I mean, and Bethany said, I mean, them not being able to hold that, that home tour is, yeah, I'm really concerned that that'll really kill them. I mean, that is their biggest fundraiser.
Jackie, why don't they just formalize the request if Ellen's involved with podcasts, et cetera, and then
Bethany, I think you can just
it to us.
Yeah,
tell her to include all the things that she has just been doing and then doing now. I mean, they're still she's still doing a ton of things. So
exactly.
And do they need the money now for this?
I mean, I would imagine they always need the money. Yeah, I'm
Can we vote
concerned
to
for
give them, what
daycare.
was it, like the $666 they already owe the facilitator for the 2 sessions that happened?
Sure. I mean, I'm fine with that.
Yep, I am.
And then I'm going to ask her for an item.
Just pay for that, right? Just the 600. Is that correct?
It was, what was the amount, Bethany? It was like,
Correct. $666 for the 2 sessions which were in progress before school was not suspended, but it was canceled in person.
And maybe she can, put that. And then I know that, and I'm really, they were supposed to have a speaker at the end of March on LGBTQ, and I know I talked to Alicia about it. That was going to be great. I think they had a lot of people registered. I think she is speaking with that therapist to see if something like that can get done, by the end of the school year, like online, so people can still attend and get that information. So maybe that's something we can support. So she can maybe come up with an invoice on, that still happening. I mean, I can talk to her if that's helpful. And I'm sure there's other things planned. I mean, I can't believe how many programs they put on, weekly and monthly.
All right, so I'll get an itemized grant request. Unrestricted.
I'm for that.
Okay, so we'll hold off. Even the 600, we'll just get a formalized request and then we will move forward.
Harrison, since it's going to be May until we meet again, can we take a vote to give you authority to allocate X amount of money based upon certain programs? I mean, I'm happy to make that motion to do that instead of having to wait until May.
Yes, if people are in favor. Like I said, I do like to see everything. These are unusual times, granted. I like to see everything on paper when we're doling out the money.
Great.
But
so
I would.
Yeah, I would make a motion, Harrison, that this commission give you the single authority to allocate up to $2,000 based upon the New Canaan Cares programs in these unprecedented times that we're in.
All right, all those in favor?
Yay.
Aye.
Aye.
Opposed? Okay, unanimous. Thank you, Russell.
What was the amount?
2,000.
And does that include the 666 or that is in addition to?
That would include, I think.
Yes.
Yeah, my motion was the total up to $2,000.
Okay, and include the 666. Okay.
Yeah, that's fine. Okay, thank you again very much for joining, and stay healthy and take the extreme precautions, all of us, despite the age.
Thank you.
Thank you.
Good one.
Thank you.
you.
Stay safe.
Bye, everybody.
Bye-bye.
Bye.
Bye.
I'm going to end the meeting now. Bye-bye.